Hello, my name is Mindy Pettis, and I'm a student physical therapist assistant from Jefferson State Community College. And today I'm going to be talking a little bit about cellulitis. Cellulitis is a serious infection that spreads under the skin, affecting the underlying soft tissue and adipose tissue. Several types of bacteria are commonly associated with cellulitis, but Staphylococcus aureus is the most common. Streptococcus pyogenes is the second most common, and less often MRSA can actually be a cause of this, or can be most commonly associated, I should say. Infection takes place when these pathogens gain entry to the skin and underlying tissue through a break in the skin. Common entryway can be a crack in the skin, it can be a burn, it can be an insect bite, it can be from trauma, it can be from a surgery, just really any break in the skin can allow an entryway. Again, cellulitis is the technical, I guess, what it actually means is just inflammation of the skin. Some signs and symptoms will be redness of the skin, swelling, tenderness, pain, warmth or fever, red spots, blistering, or skin dimpling. And I hope you can see these pictures, but they're going to kind of show you what it would actually look like on the skin. As far as how it's diagnosed, there's no gold standard way to diagnose cellulitis, so more commonly other differential diagnosis must first be dismissed, and that could be eczema, blistering edema, deep vein thrombosis, thrombophlebitis, or vasculitis. Those are all going to present with similar symptoms. So typically vital signs, full blood work, swabs of the area if there's any discharge, and mycology are taken in order to rule out those other diagnoses. Blood cultures are crucial to obtain before treatment in order to assess for sepsis before the patient actually begins an antibiotic treatment, which I'll talk about that later. As far as who's affected, it's really common, so anyone can actually develop cellulitis, but more commonly middle-aged or the elderly are diagnosed. As far as what puts you at risk, previously infected individuals are at a greater risk due to damages to the venous and lymphatic drainage systems. Obesity is also something that can put you at risk, and that is due to the fact that obese individuals typically have some swelling in their lower extremities, and that can put them at a greater risk to developing. Diabetic individuals are also at risk. They typically have circulatory problems, skin failure. They have delayed healing, which can cause chronic ulceration, and also it can sometimes be difficult to detect with those patients if they have any type of peripheral neuropathy. They won't be able to actually feel it. And also individuals with skin issues like eczema or psoriasis can be put at risk, and immunocompromised individuals, of course, would be at risk for this as well because they have a decreased ability to fight infection. Excuse me. As far as medical prognosis goes, it kind of depends on where the infection is located, but cellulitis can cause a great deal of pain for individuals that are affected. In more severe cases, sepsis, localized gangrene, or necrotizing fasciitis can occur, so a patient could actually lose a limb if this remains untreated. As far as treatment goes, an oral antibiotic is most commonly going to be the first thing that's prescribed for these patients, and that can be cephalexin, penicillin, amoxicillin are some of the more common. In some severe cases, an antibiotic may be given intravenously, and in those cases, those patients would have to be hospitalized. But wound care is imperative. You have to keep the area clean bandages. That is one of the most important things that these patients can do. As far as physical impairments, painful ulcers in the location where the point of entry has occurred is going to be the physical impairment. As far as functional limitations go, bathing, dressing, sitting for any length of time, staying on their feet for long periods, all of those things can become more difficult depending on where the area is located. Depending on where the ulcer is located. As far as a disability goes, work requirements can become more difficult to complete due to pain. And again, that's just going to depend on where the infected area actually is. As far as physical therapy treatment goes, it's going to fall under pattern 7B, which is impaired integumentary intervention associated with superficial skin involvement. So, common evaluation tests and measurements are going to involve balance, circulation, gait, integumentary integrity, mobility, muscle performance, pain, range of motion, self-care, and sensory integrity. And as far as treatment goes, managing inflammation and edema is going to be the first priority for therapy for these patients. In addition to that, patient education is going to be really vital here. You're going to want to instruct them to keep the area clean and bandages changed. Massage can actually promote lymphatic drainage, so depending on where cellulitis has occurred on the body, that could be an option. And range of motion activities should typically begin as quickly as possible, just to prevent any type of contractures or weakening, and that can progress to strengthening as it's tolerated. As far as precautions and contraindications go, that's going to vary depending on comorbidities, severity, and condition of the skin. Prevention is key here. Recurring cellulitis is common, with 22 to 49% reporting at least one previous episode of disease in their lifetime. So prevention: avoid injury, check feet, hands, legs, and arms for abrasions or cuts. That's going to be, again, important with diabetic patients because they may have decreased sensation. If there is a wound, you want to keep that clean with mild soap, cover it with an antibiotic ointment, and a clean bandage. And you're going to want to keep a handle on underlying infection or disease. I'm sorry, that's my dog walking across the floor. Repeated episodes can occur due to the fact that the initial infection was never completely eradicated. So it's important to finish that antibiotic treatment even though you may think that the infection has been cleared. So in conclusion, due to the nature of cellulitis, pharmacological intervention is going to be the only way to completely eradicate infection, but PTs and PTAs should be familiar with the disease process in order to aid in recovery time and to educate patients of how to prevent reoccurrence. So that is all that I have for today, but if you have any questions, please comment below. Thank you for watching.